Good evening, class. We're going to spend a few minutes today talking about, going to move into kind of a different um, set of information or a different process when it comes to healthy informatics, business intelligence professionals, especially in the healthcare field. And we so far we've talked about billing codes, we've talked about diagnosis, we've talked about HIC-PIC levels 1 and HIC-PIC levels 2. We've talked about revenue codes and talked about MDCs and DRGs and all of the potential codes that can be used by a provider as they bill a payer for the goods and services that they have provided to a consuming population. And we've also talked about, filling out the CMS 1500, which is the form that most non-institutional, non-facility providers submit claims on. Also talked about the CMS 1450 or the UB04, which is the billing form that institutions and facilities use when they bill the payer side of the house or the payer side of that financial coin for those goods and services that have been consumed by those members that are enrolled. This is probably as good a term as any on the payer side. And then we kind of followed up with what the life of a healthcare claim looks like from the time that the member signs up with the health plan till they go to that initial visit at the doctor's office or at the hospital, whichever provider they happen to see first. Information they provide. Again, we've got huge issues in healthcare with asymmetric information, principal agent issues, and we've talked about in the life of claim, and it ultimately leads to the provider billing the payer for healthcare goods and services again consumed. And at that point, so you've got kind of the pre-adjudication, you've got the adjudication process, and then you've got the post-adjudication process. And we've kind of gone through that in the life of a claim. Well, tonight we're going to move into the claim is processed, the payment's gone out to the provider, and we're going to, at this point, start to delve into how all of this information is stored. Not only how it's stored, how it's utilized, what the effects are, and going to start to build you into hopefully a more well-rounded understanding of what you could expect if you decide to go into kind of the field of healthcare informatics or healthcare business intelligence or healthcare financial analytics, actuarial science on the healthcare side of the house. It's all going to be kind of the building blocks and the basics of what you could expect. And also for those of you that decide you don't want to go into the healthcare field, a lot of what we're going to go through, you can overlay and you can, transfer it to retail services, to manufacturing, to just a lot of market economies, a lot of market industries. And what I've decided to do is we're going to work this module, this particular module, and I think this is going to be module 8. We're going to work module 8 from the payer side of the process, and going to focus on, from a payer's perspective, how they are utilizing data repositories, how they're utilizing data warehouses. And then on module 9, I'm going to flip and glean some information from the internet that's going to give you kind of a different view, the view of the provider side and how they are managing the information and the data that they have and what they find useful or not useful when it comes to managing that data. So I'm going to try to join modules 8 and 9 at the hip. Again, module 8, we're going to try to focus on the provider side, even though a lot you'll notice as we go through 8 and then again in 9, when I go to the provider side, you're going to see that a lot of the information kind of overlaps, and you'll start to get a sense of why so many individuals in the healthcare space or the healthcare environment tend to flip-flop back and forth, tend to work for a while on the payer side, then they'll flip back to the provider side, and then they'll go to the payer side. They're working both sides of that financial coin. And as we go through this, hopefully through these two modules, hopefully you get an understanding or a feel as to why that could occur. And we're just going to jump in for the first few minutes, going to get through some, I guess, some basics of data repositories and an understanding of data repositories. And let's start out with just the definition. So a data repository, it's a large infrastructure. It collects, it manages, it stores data sets for analytical purposes, for sharing among individuals at a specific entity, for generating a multitude of reports, for forecasting outcomes, for just a wide variety of opportunities that individuals on the analytical side of the house, and again, it doesn't matter whether you're health informatics, whether you're data science, actuaries, financial analysts, a lot of that information is stored in these data repositories, and that is going to be the source of your analytical workload for the most part on a daily basis. Secondarily, when we're talking about large kind of infrastructures that collect all of this data, you're going to hear, especially once you get into, or if you do get into the healthcare arena, especially, you're going to hear the term data warehouse thrown around. And it's it collects this information. And as it collects this information, it's bringing it together in a structured data format that can be queried, can be analyzed, and it's usually for a specific program. And with the data warehouse, the schema or the format or the structure, the infrastructure of that data warehouse is typically determined or defined before the data is stored. And as an example, let's say that we're talking about the member file that's in the data warehouse. Is it stored first name, last name? Is it stored last name, first name? Where do you store the Mr., Mrs., Doctor? Where is all of that? What is the format or the schema of that data that's going to be stored, and how is it going to be stored? Because that's going to be extremely important for the individual that is trying to extract that data. Take date of service. Is it month, day, year? Is it day, month, year? Is it for January the 1st, 2024? Is it 01/01/2024? Is it 01/01/24? Is it 1/1/24? All of this structure is, at least it should be defined before it goes into that data warehouse, because you're going to have that data warehouse as the data repository, and it's going to be your source of truth. It's going to be the source of truth for a multitude of individuals within that payer organization that's going to be trying to access this information. So again, data warehouse, structured data to be queried, to be analyzed, typically for specific purposes, even though there's going to be you will find there's a lot of data included in that data warehouse that you may never use. It's there in case you need it, but you may never use it. And it's going to depend on really what functional areas that you are associated with within that particular payer organization. Information in the data warehouse, it drives the operational and the financial success of any payer organization. That accuracy of the data in that warehouse and the ability of those analysts accessing that data is going to be key in the decision-making process, the strategic planning process that drives that operational and financial success of that organization. Now, when you start talking about it, and again, it doesn't necessarily have to be healthcare, but anytime a company has a data warehouse, with healthcare, sometimes it's called an HDW, healthcare data warehouse. Sometimes you hear it called an EDW, enterprise data warehouse. Especially if you get outside the healthcare realm, you'll hear a lot of companies talk about their EDW. I had the EDW meeting today, or my job is I'm one of the administrators of the EDW. And that's what they're talking about. They're talking about this data warehouse that is storing information that's going to drive the operational and financial success of that given company. Lately, you've been, if you listen to the talking heads on TV, you're going to hear them, banning around this concept of a data lake. And we've got this data lake, and Google's got a data lake, and Amazon's got a data lake, and so and so has been using their data lake to drive the success. Just what the heck's a data lake? And it's unstructured data that's tagged with metadata. And we'll get into metadata in a few minutes, but it's unstructured data that's tagged. Just think about a lake, and it's just thousands and thousands, or even upon millions of observations of untagged data that's floating out there. It's raw data, not processed for a specific purpose. It takes a larger storage capacity because the schema and the format is not well defined. However, it's flexible, it's quickly analyzed, and when it comes to AI and machine learning, it is maybe the preferred format, or maybe it's the preferred type of repository or structure for the data to enable AI or machine learning when it comes to, especially in healthcare. And the schema for the data is really defined after it's stored. After that data is dumped into the lake, and you start running, AI, artificial intelligence, machine learning, linear regression models, at that point, you may start to define, and you may have to put some definition on the data. But that's what we're talking about when it comes to a data lake, just a huge repository, expansive repository of information that's just floating out there, ready to be used, unstructured form, and individuals, they like the flexibility, they like the way it's queried, they like just the breadth of the data that they have access to, and they're okay with it not being structured because they're going to write code that's going to structure that data as they feed it into the models as they're trying to move, artificial intelligence and machine learning going forward. Then you'll hear, as I said when I talked about data lake, you hear the term metadata. In metadata, it's just talks about the data source and the representation and how the data is captured. You'll hear a lot of individuals in IT talk about metadata, and it's data about data, and it's basically descriptive, contextual, how it's organized, how you find the data as far as the source of the data, how do you understand the data as it's fed in. It, at least in theory, helps to answer, when was the data collected? How was it collected? Why was it collected? Who collected it? Where was it collected? Just taken as an example, it's customer service survey for a health plan. It talks about, what time, what the time period. So when was it collected? How was it collected? Was it a mail type survey? Was it a phone survey? Was it an internet survey? Why was it collected? Were there issues with customer service? And the senior VP of operations all of a sudden decided that they needed to figure out, why they're having issues with customer service. Who actually managed the process? Was it some manager in customer service? Was it the director of customer service? Was it somebody from medical economics, or was it somebody from actuarial or finance? Who was actually, managing that survey process? And then lastly, it may talk to you about where the survey took place. If it's an organization that has, multi offices scattered across the United States, was it the Mid-Atlantic office? Was it the Southeastern office? Was it a global office somewhere, maybe in the Pacific Rim or in Western Europe? And That's what you're talking about when you're getting into metadata. Is it provides descriptive information and contextual information about the data that's going to be either in the data lake or data that's actually stored in the data warehouse. And then another kind of set of terms you're going to hear people talk about data marts, and you're going to hear people talk about data cubes. And data marts are, they are subject area marts. And you hear people with especially healthcare call them SAMs, subject area mart. We're going to work on our SAM today. And when you're talking about subject area marts, it could be somebody from network management, and they're in there they're trying to figure out how to set the rates, working with actuarial, trying to figure out how to set the rates on the new contract negotiation. And they're in the SAM, and they're looking at paid claims data, they're looking at provider specific information, they're looking at what types of members are going to a specific hospital. Is it a Medicare Advantage group of members, or is it more Medicaid? Is it more commercial, more TRICARE, more VA? They're trying to figure out how to set the rates to negotiate the contractual arrangement with a hospital or with any provider in general. And that's why they're in this data mart. It's a SAM, it's quicker, it's easier, it's something that they have already structured. And it just makes their life a lot more efficient, and it's a lot more user-friendly approach to extracting the data in a timely fashion. It's a source of truth for a specific domain. Again, network management, medical management, payment integrity, could be operations, could be, again, back to the customer service area, could be their domain. It's by functional area, it could be by project, could be by purpose. Maybe it's a mailing. Maybe go back to that survey. Maybe they're going to mail that survey, or maybe they're going to email a survey. They're working then in a data mart that's got email addresses for the members that they're trying to survey. It's a specialized compartment in the EDW or the HDW, depending on what kind of terminology you want to use. So data mart, it's subject matter marts, it's SAMs. If you look at data cube, it's a multi-dimensional data structure. Data with 3 or more dimensions stored in a table. Go back to when we were talking about billing. We were talking about MDCs and DRGs. So we're talking about inpatient services. You could have a data cube that is multidimensional, that has hospital information, that has MDC, DRG information for a specific hospital or for all hospitals, and they can have it for years. So let's say you're looking at a hospital and you want to see the number of normal vaginal deliveries in a given year. So you've got a cube set up. You've got this data cube, 3-dimensional set up, got hospital, got DRG, and got 2020, 2021, 2022, 2023. You've got the years in there. So again, multidimensional. You can look at correlations. You can piece information together. It allows analysts across multiple dimensions. Aggregates, slices, dices data. Online analytical processing, and you're going to see this quite a bit, actually. They call it OLAP, online analytical processing, OLAP. And data cubes are used for this online analytical processing. It interfaces across and supports business intelligence and decision-making process and healthcare informatics. Individuals have decided that depending on what your project is or what the request is, or from what functional area the request is, rather than spending sometimes an inefficient approach and going in and querying the entire EDW, you're going to have set aside a little data mart. You're going to go in there and you're going to grab the information out of that data mart quickly and very efficient. Or you're going to have a data cube and you're going to go in there and grab that information out of that data cube quickly and efficiently. So, and again, it depends on size of the health plan, depends on the project, depends on who wants the information, depends on the timeline, depends on a lot of parameters, but that gives you kind of an overview of data repositories, terminology you're going to hear, uh, just a lot of opportunity for you to consider if you're going to move not only into healthcare, but if you're going to move into any market economy, any industry, and you're going to be working in an analytical space. I'm going to talk for a few minutes about benefits of data repository. Uh, with a data repository, EDW, HDW, decisions, because of the information stored, the structure and the schema and the format and just the expansive variety of the information stored in that data repository, you're going to be able to base not only your decisions and your analytical expertise and your reporting expertise, you're going to be able to base it on information. Remember, data, information transforms data into manageable risk, and risk can be managed. And risk can be managed in such a way that it is important in the decision-making process, the strategic planning process of any entity, of any type of company. And at that point, you're going to be able to provide information to the decision maker in your company. Could be the CFO, could be the CEO, could be CEO, chief actuary, senior managers, could be your director, could be your manager. And you'll be able to provide them information that is based on, you hope, accurate data. Sometimes in healthcare it gets a little iffy, but you hope the data has been vetted in that information warehouse or that data warehouse and it's ready to go. And the decision makers are going to have information that they can base decisions on rather than anecdotal and instinct and gut feel and today's Monday and I think Monday should be. You hear all of these types of comments from decision makers, and at the end of the day, you want the decision to be unbiased and the decision to be in the best interest of the company, both in the short term and in the long term. Analytics driven by a single source of data. You have a single source of data in a data repository, whether it's a data cube, data mart, EDW, data lake, you're going to have a single source of information. It's going to make it easier for data governance and the data dictionary to manage. Give you an example, Blue Cross Blue Shield, where I was employed in Buffalo. There was a data governance team that worked for me. Their responsibility was to ensure and to vet the information feeding into that data warehouse that it was accurate and complete. But it was just not my team that made the decision. There was a data governance committee, payment integrity, network management, medical management, internal audit, risk adjustment, risk management, legal, operations. Everybody had individuals, IT, everybody had individuals sitting on that committee and providing input not only into the decisions of the data governance committee to ensure that information was correct, but also in how that information flowed into the data dictionary. Because the data dictionary not only defined the format of the data in the data fields, but it also defined the definition of those data fields. Payment date. So health plans are always concerned about the payment date. It's the day that's when they're responsible. That's when they are liable for paying for that healthcare good or service. That's when they're supposed to send that check out the door to the provider. And there have been, I can remember sitting in a data dictionary meeting, and people arguing over the payment date. You know, one group said the payment date's the date that the claim actually adjudicated. Okay, could be the date the claim actually adjudicated. Another one says, well, it's the day that the funds go into this no man's land sitting out here to be held and ready to go out to the ACH payment to the provider. And another one says, well, no, it's the date that the actual payment, goes out to the provider. The date the check is cut, if it's a paper check, or if it's a paper check going to a member, it's the date that check's cut. Somebody else in the back of the room said, oh, no, you're all crazy. It's the date that the provider actually receives it into their bank account, whether cash the check or whether the money actually clears the ACH. It went on forever. Finally, it was determined that the payment date, and everybody, we finally agreed on it, that the payment date was the actual day that the money went out the door to the provider. Check was cut and mailed. ACH payment shot out the door. That became the payment date. And that's why data governments and data dictionaries are extremely important benefits of a data warehouse, because again, you've got a single source of truth. If anybody has any question about what the format or what the definition of a data field in the data warehouse is, they can go back to that data dictionary and look it up. Single source of truth, everybody on the same page. Also, a single source of truth, when it comes to data, it's easier to secure. Rather than having 15 small, specialized data warehouses floating around a company, have a single source, have a single enterprise data warehouse. It's much easier to secure. You don't have you're not faced with the level of risk as far as data integrity, or somebody hacking into the information, or somebody providing the information, or having access, especially the information that they shouldn't have access to. Backup strategies are easier to implement. It's always, you want to spend whatever resource necessary to ensure that you have a backup strategy in place when it comes to your enterprise data warehouse. You have got to have backups. There are, I don't want to say a million, but there are a number of reasons that data can be flawed. It can be power surges, can be somebody in the data administration group hits the wrong key. And if you don't have that data backed up, then how do you know to go back to that point where the data was accurate and start working forward from that point again? Benefits of a data repository: efficient reporting and analytics. Depends on who and what programs you're fooling with, or who and what programs you're trying to generate reports and analytics for. But if you've got a single source of truth, you've got multiple individuals working in a information or a enterprise data warehouse, and if questions come up that may not be addressed in the data dictionary, or if you have, and it happens a lot with analysts, with data scientists, healthcare informatics, business intelligence, financial analysts, it happens. They have work groups, or at least in most health plans, there are work groups. And those work groups have email chains. And they will have an email list, and you're sitting there working on your data, and and that, whether it's a cube or a mart, or you're going back and hitting the entire enterprise data warehouse, and you run into something that doesn't make sense to you, or something you don't understand. And you can shoot out a little, you can do a chat, you can shoot an email to everybody on that email list, and be surprised how many people are going to help you. They're going to say, oh yeah, I've run into that problem, and we've worked on it in the work group, and here's the way we decided we were going to resolve that problem. You see it a lot in, give an example. I go into the emergency room at 1 o'clock. Let's see, today is the 20th. I go into the emergency room at 1 o'clock on March 20th. I'm in the hospital. They fool around, they run some tests. Doctor decides, yeah, he, needs to be admitted. They admit me at noon, run some additional tests, and another doctor comes back and they say, I think he's okay. He had a little heart palpitation. Let's just send him home. They discharged me at 10 o'clock on the 20th, 10 o'clock on March 20th. I've been there from 1 o'clock in the morning, 10 o'clock at night on March 20th. What's my average length of stay? How do you figure that one out? Admitted on March 20th, discharged on March 20th. Length of stay is calculated discharge date minus the admit date. March 20th minus March 20th, 0. And those are the kind of answers that you will get, the issues you may run into, and you can reach out. And even though it was, and you have some people, especially in a data group, that I hate to say it, but they're just too lazy to go to the data dictionary. So they run into this and they say, oh my God, I gotta handle this. And they start shooting chats out, and you get an email and you look at it and you say, oh my, all you got to do is, and you'll respond to them in a politically correct manner. And you'll say, well, we went through this, and even in the data dictionary, you're going to have not only the definitions, but you're going to have a comment section. And you say, if you go to the data dictionary and look up length of stay and how to calculate the length of stay, on July the 1st, 2019, we determined that if the admit date and the discharge date are the same day, then you automatically set the average length of stay to 1. And so that was the decision. Data governments decided, that's what went in the data dictionary, and that is how you resolve that issue. So that is the advantage of having data governance, a data dictionary, and a work group that you can get together with to answer your questions. Data administrators have an easier time evaluating issues. If you run into issues, and data governance and data administrators, as data feeds into that EDW, you're going to have programs spinning through with predetermined edits in them that kicks out observations if they look really weird. You will have people, we would just take bill charges. So bill charges, again, we talked about it on both the 1500 and the UB04. Bill charges, that's what the provider charges or bills for that service. Doesn't mean that's what's allowed by the contract or what's going to be paid or what the member owes. It's just what the provider bills for that service. And you may have, especially on hospital claims, you may have coded into the system to kick out any claim that's greater than $100,000, let's say. And so that you're added in there as that data feeds in, so claims data is feeding in, it's going to kick out any claim with total bill charges of greater than $100,000. And your administrator or your, somebody in data governance that's vetting the data, they're going to sit there and they're going to get those printouts and they're going to start looking at it. And you'll see some really weird stuff. Let's say you've got a normal vaginal delivery that kicks out with bill charges of $1 million. What's happened is, let me make sure I've got my numbers right. So, $10,000, you add a couple of more zeros to them, that's going to get you to $1 million. So what happened is somebody keying in, either the system didn't put the decimal point So rather than 10000.00 for $10,000, it ends up in the system as $1,000,000. And these are the kind of things that will kick out the information warehouse administrators or data governance individuals assigned to it are going to vet that data, and these types of information are going to pop out. They're going to take a look at the claim. They're going to figure out what the real number should be. More than likely, they're going to go back to the original claim itself, and they're going to find, oh, it should have been $10,000. They're going to make the correction. It's going to feed back into the data warehouse, and it's vetted and everything's going. And if you've got a data repository as a single source of truth, it makes a lot of sense and it's easier to do. Data is preserved and archived. This is extremely important from a legal perspective, from a liability perspective. At a lot of health plans, they are archiving that data at least 7 years and a lot of times up to 10 years, especially if you've got fraud, waste, and abuse cases, especially if you've got some kind of mass tort or data liability or subrogation or any kind of a potential legal issue. You want that information kept, and and it's not only just the actual audits that you may have gone through, but you want the medical records. You want all the documentation kept, and you're talking about medical records and charts and itemized billings across all functional areas, and you want them kept, and you want them stored, and you want them archived. It's mainly driven by the litigious aspect of healthcare, but it is if you've got a single source of truth or a single data repository, you can preserve and archive this information. Now, you may have it set up in that information warehouse or that data repository in such a way that if it is a sensitive type of document information that only legal has access to it, or only risk management has access to it, or only internal audit has access to it, you can structure, you can identify the access, but again, you've got to have some way to store it. Going to quickly go through just some disadvantages. I mean, with everything, there's advantages and there's disadvantages. Disadvantages of a data repository: data security risk of a single source data. And the disadvantage is you've got unauthorized users, you've got hackers, you've got people within the company that steal somebody's password, that gets in and they have access to the entire database, the entire data repository, the entire EDW. Again, hackers, information, it's not out of the ordinary for information to be stolen from a health plan by individuals employed by the health plan. They look over somebody's shoulder when they get on the system, they watch, or somebody writes down their password. Some analyst is writing down the password, sticking it under their laptop, or sticking it on a QB, or sticking it in a drawer. And they grab that password and they're stealing information and selling it on the black market. And it really gets involved when you're talking about HIPAA type information, access to sensitive type of information, to contracts, to legal issues. There actually have been in the past individuals that have been able to, they go to work for a health plan and they steal somebody's password, and they get in and they start reprocessing healthcare claims. They start diverting, patient checks to different bank accounts. So you have to be really careful on who has access to the information. Disadvantages: it's a drain on internal resources. And again, it's a drain on internal resources. Go back, I think about all of the hours that are spent in data governance, making sure the data dictionary is the way it should be, thinking about IT, operations, and payment integrity, network management, medical management, internal audit. We were spending a lot of time working as teams trying to ensure that the data was accurate. It had to be done because you couldn't have inaccurate data driving the financial and operational decisions of the company, but it was a drain on resources. It's a drain on system efficiencies, having a large enterprise data warehouse. Um, can database manage? You're talking about system inefficiencies. You have to have a database management system that can scale with data growth. And sometimes health plans don't. Sometimes just companies in general have enterprise data warehouses and they can't scale with growth. And so then they end up having to parse it out, having these multiple data warehouses they're trying to cobble together. And it's just you've got to have scale, you've got to have scalability, and you need to make sure you've got that scalability if you're on the planning side of the house when you're going in and trying to develop that data warehouse. System crashes impacts all the data. Backup databases, isolate access, applications. If you've got multiple data warehouses, if one of them crashes, you still got some others running. But system crashes just happen. Unfortunate, and it is a strain on the corporation, a strain on the company, but they can happen, and that's one of the disadvantages of data repository, because you've got to have backup databases and you've got to be able to isolate access applications to those databases. Cost of infrastructure. That's one that every CFO in a health plan is worried about. What's it going to cost? How much money am I going to have to pay out of pocket? How is that going to impact my profit margins, when we're going forward, especially if you're a for-profit organization. Your CFO is always concerned about earnings per share and going back to the stockholders. How much is it going to cost? And he's concerned about, do you insource, the data warehouse? Do you outsource the data warehouse? What's it going to cost? How's it going to impact the financial well-being of my health plan? We're going to stop here just a minute. When we come back, we're going to talk for a few minutes about working with data repositories. See everybody again in a few minutes.